Welcome along, everybody, to our webinar this evening for World MS Day. Tonight we're going to be discussing diagnosis. I'm Leanne. I'll be here facilitating this, or co-facilitating, and I work for the MS Society and the Live and Well team, and we deliver webinars. And tonight we're delivering this one in partnership with MS Together. And we have a fabulous panel, so I'm really looking forward to hearing from everybody as well. As you've logged in, you'll see that at the bottom of your screen, there is the chat box. So you can post anything there and share anything. I'm just going to change the setting there so that you can all see what everybody's posting. So chat box is there if, as the guys are chatting, you want to share your experiences, pop it there. And if you have a question that you want to ask, you'll see beside that is the Q&A box. And you can pop any question in there and you can ask it anonymously as well. And there'll be an opportunity at the end, and we'll put your questions to the panel there as well. So there is that. You'll see there is also closed captions. So if you need captions, you can hit that button and it will make it a little bit more accessible for you this evening. And I have it will be recorded and it will be getting shared afterwards. And I will be following up with an email as well as the guys are chatting. If there's any useful links that we're discussing, I'll make sure that that is in the chat box, then the follow-up email as well. And it is just a really great opportunity to hear from people with MS. And also to put your questions to them, but we can answer any specific questions relating to your health. So that is the one thing that I would say, but it'll be excellent to hear for the guys this evening. And I'm going to hand it over to Amy.
Thank you. Hello, everyone. My name's Amy and I'm the founder of MS Together, which is a relatively new charity providing services of advice and support to people affected by MS, but with a particular focus on people aged 18 to 35 living with MS. So obviously quite a lot of those people will be newly diagnosed, which is why we've partnered up with the MS Society for World MS Day. I do also live with MS myself. I was diagnosed back in 2018. And I'm delighted to be joined by Liana, Alicia and Sean, who are all also living with MS, and Razia, who is an MS nurse and works on the MS helpline at the MS Society. So just very quickly, I'm going to ask them all to give you a very brief introduction of them, and then we'll jump into some more questions about diagnosis. So Liana, can I start with you?
Of course. Hi, everyone. My name is Liana. I am 37 and I live in Aberdeen. I was diagnosed with MS in 2013.
Amazing, thank you. And Alicia?
Hi, I'm Alicia. I'm 35. I was diagnosed with MS 5 years ago today on World MS Day, which I didn't know, in 2019.
Amazing, thank you. And happy MS birthday. And Sean, over to you.
Oh yeah, I'm Sean, 37, live in the Midlands, and I was diagnosed with relapse-remitting MS in July 2022, so I'm just going up to 2 years post-diagnosis.
Brill, thank you, Sean. And Razia, over to you as well.
So my name is Razia Khan, one of the MS nurses. I work on the helpline, the MS Society helpline. I have over 13 years experience of working as an MS nurse in the NHS, supporting MS patients. My initial journey started in the rehabilitation ward, and then I was an MS nurse for over 13 years. Yeah.
Amazing. Thank you so much. What a brilliant panel. So to start us off, we're going to take you back to the very start. So can you please tell everyone what your first symptoms were and what your kind of diagnosis looked like? I'll come to Alicia first, if that's all right.
Yeah, my first symptom on reflection now, my first symptom was numbness of the left leg, but because I was heavily going to the gym, I just thought it was a gym injury. That was February 2019. And then in April 2019, I woke up with blurred vision in my left eye, and it just progressively got worse throughout the day. I was in the Midlands at the time celebrating my sister's birthday, and I went to the hospital there and they did a little test of some sort. By that time, I went to Dr. Google. They kept saying optic neuritis. And then they came back after the test and said, you've got optic neuritis. I live in London. I returned to London thinking I could go to Specsavers and Specsavers were going to sort it. And I ended up at Moorfields Hospital on a fast track to get an MRI. I did a study, so the MRI just lasted a lot longer. And with it, that was the April, and by the end of May, today, 5 years ago, I was officially told I had MS.
Wow, so quite quick for you, really.
On
Yeah.
on reflection, in comparison to now getting to know other people, I'm realizing I was diagnosed quite quickly.
Yeah, amazing. All right, thank you for sharing that. And what about you, Sean?
My story in terms of diagnosis was probably a bit longer. I had very similar to Alicia, optic neuritis back in 2014. And they said at the time, don't think it's anything more at the minute, but you're going to be dropping from a 1 in 100 to 1 in 3 risk. Over a space of about 5 years, the optic neuritis flared up probably another twice. And then back in 2021, it flared up again. And the opticians that I used said, we're not happy with this. We need you to go to the QE and get it sorted, which I did. As part of the scans that the ophthalmology team were doing, they found the lesions, both brain and spinal lesions. Said, don't think it is, but we'll refer you to a neurologist. And it turns out July 22 was the day where I got diagnosed, and that was it really. And it turns out that a lot of symptoms that I thought were associated to other things, I'd had sciatica on and off for years, back pain, numbness in my left leg, foot drop from a back injury back in 2015 and all that sort of stuff. And there's a lot of things out there that were probably my undiagnosed MS. So yeah, that was me really.
Yeah, I think that's the case for a lot of people, isn't it? Like they can kind of date back symptoms that they experienced before, and then obviously at the time you have no idea that it could be MS, and then
Absolutely.
yeah, it's only
Absolutely.
when you realise. Amazing, thank you. And Leanna, I'll come to you. What was it like for you?
So I think I said I was diagnosed in 2013, but much and such like Sean. My first symptoms started. I had optic neuritis. I had a black spot in my eye, and like a pain at the back of my eye as well. And this was actually a couple of years before I was diagnosed, probably about 2, 3 years before I was diagnosed, actually. And then I was back and forth. I came back from a holiday one day. I had numbness in my hands. I was in, I think it was Greece or Spain or something. I thought it was weird to come off my flight and I had like pins and needles in my hands. Went to the doctors, got a few more tests done. However, nothing came from that. And I went through a little bit of a tough breakup. I'd split from my partner. I started playing rugby, and when I was playing rugby, I was going through a lot of stress at the time. I was playing rugby and I was in training, and all of a sudden I was running backwards and I was falling over, and I was like, okay, I'm not that bad at rugby. I can actually play. Why am I falling over? So I went back to the hospital for tests. And while I was getting tests, I was in work, I was walking into walls, all those kind of things. And then in April 2013, I was diagnosed with RRMS. I had some lesions on my brain. And I suppose for me, I was on my own. I didn't Google, nobody had told me anything. I was on my own. I went to the hospital and I was like, oh, wonder what's going to happen today. And yeah, lo and behold, my kind of world kind of shattered within seconds. So yeah, that's it for me.
Wow, so quite a big shock for you as well.
Yeah, for sure.
Yeah. Thank you all for that. Razia, I'm going to come to you. This might be quite a difficult question, but can you just tell us a bit more about what a kind of typical MS diagnosis would look like? So, through what tests are done and how long an average MS diagnosis takes? I know, again, that might be a very difficult question to ask, but just kind of what it looks like for most people.
Yeah. So like you heard from Alicia, Liana, and Sean, everybody's experience can be different. So some people may have a sudden severe attack, and then some other times it's like a question about what and which approach to see how symptoms develop, as that can be a way of distinguishing that this can, from other conditions, because other conditions can also have similar symptoms to MS. And it is a quite complex condition to diagnose as well. And for a lot of people, it's hard to pinpoint when the MS begins, as the early signs and symptoms can be different for everyone. Um, and the tests that are often formed would be, the first one would be, you would be your GP would be your first point of contact. And then on GP's, on examination, they'll decide whether they'll refer you to a neurologist, and then neurologists may organize a neurological examination, MRI scan. Sometimes they'll do a evoked potential test where they put electrodes on your head, arms, and legs just to see how quickly the messages travel. Depending on what the MRI scan shows, you may need a lumbar puncture. You may also need blood tests to rule out other conditions. And there's a tool that's used by the clinicians, which is called McDonald criteria. It was revised in 2017. So where in the past, before 2017, you would have to have one episode, which would be called clinically isolated syndrome, and you'll have to wait for the second episode to be called multiple sclerosis, which is MS, multiple lesions. But with this criteria, it's a tool that's used by the clinicians now. And since 2017, say you have one episode, but then you have an MRI scan, but then you have another MRI scan, maybe 6 months apart or a year apart. And if the new MRI scan shows new lesions, new area of damage, then that can be your diagnosis without having second episode. So that's the difference. So that's, I think, the main one. So everybody's journey will be different, because not everybody will have similar symptoms.
Yeah, definitely. I think it's important to talk about that tonight as well, because obviously there's people joining who might not even know what MS is, and it might be colleagues of people or friends and family. So it's really important to kind of get that background as well. So thank you. Next kind of question is obviously still to do with diagnosis. So to Sean, Alicia, and Leanna, what were you've kind of touched on this a little bit, but what were your initial thoughts when you received your diagnosis? Was it a relief or was it a shock? I know, Leanna, you said for you it was a shock. And also, did you know what MS was? What were kind of your first thoughts when you got diagnosed? Leanna, I'll come to you first, if that's all right.
Of course. Initial shock for sure. I was, like I said, I went to the hospital myself. I didn't think anything of it. And yeah, I walked into the hospital, and the doctor I had at the time, I would say, I'm sure everyone's got experiences. He wasn't the most. He was a bit old school. He was a bit like a footballer, an Aberdeen footballer. He's been recently diagnosed with MS. He's getting on with life perfectly fine. And here's me. I know some people that had MS or have MS at the time when I was diagnosed, and you think worst case, right? That's what some people think. They think worst case. So I came out of that hospital and I cried and I cried and I cried, and yeah, I was inconsolable for quite a few days. But yeah, that was kind of the first initial thoughts until I read up some more and got a little bit better understanding. I got take some leaflets home and yeah, read until your heart's delight with lots of leaflets. But yeah, that was the kind of initial first stages for me, was the shock.
Yeah, that was very similar to me with the leaflets being handed, and yeah, it was just a very kind of confusing experience, I think, for so many people as well. Alicia, I'll come to you next, if that's okay.
I'm glad you've got leaflets. My diagnosis was very quick, but I was told that somebody would contact me and nobody ever did. And in the process, I relapsed and ended up in hospital between the June and July period. And I didn't know what was going on. I didn't really know much about MS. Ignorance on my side. I associated MS with white people. I just didn't know no black people that had it. I didn't know anything. Do you know what I mean? It was just ignorance. And I think I was just not in denial because I was still doing everything that I could do, going gym, going work. I was studying at uni. August 2019, I relapsed again. And so I was having these relapses, and I wrote a stern letter to the hospital like somebody needs to come. I don't know what's going on because I think panic set in now. And I had a great MS nurse. I believe she's retired now. Her name was Sarah. I think she's retired now. Her name was Sarah, and she sat down and she sat with me and explained to me in detail what MS was. She explained to me in detail about medication, and I was so just thankful because you read everything on Dr. Google and it can be a nightmare, but she really took the time out to explain, do you know what I mean, what is happening with me. And I was just so, so grateful for her. Just so, so grateful. But I think I was still in shock before I could come round. I relapsed again. Do you know what I mean? So my relapses were quite rapid and quick. And yeah, took a while for me to kind of get my head around.
Yeah, I think that's completely understandable, especially when you're having all these relapses as well. You know, it's hard enough to deal with the diagnosis anyway, let
Yeah,
alone that on
most
top.
definitely.
Yeah, thank you for sharing that. And Sean, I'll come to you now.
Um, I'm very much like Leanna. It was shock, relief. I'd been told 3.5 months previous to my actual diagnosis that, we think it could be. That's what we usually associate lesions with. A lot of people have got them and it's nothing, so don't worry about it. And it really played on my mind. So I can still remember sat down and the neurologist saying, "I'm afraid, Sean, that it's multiple sclerosis." And I smiled, and it kind of felt a bit perverse that I'd smiled, but it was such a relief to know what was going on. And then I think the fear set in for the future. I've got some quite challenging personal circumstances alongside the multiple sclerosis, and a lot of responsibility to come later in life, and it was fear. And I had a lot of leaflets. Colleagues bought me a book. It was multiple sclerosis for dummies. And it was sat there in the living room at home, and every time I looked at it, it just, you filled up. It was difficult. It was very, very difficult. But yeah, it's not particularly common or as common in men. And you don't think, well, there's not going to be any other men out there that have got it. And I feel like I'm on my own and all that sort of stuff. I think, like with Alicia saying, she didn't know that anybody else that was black that had got MS. And it's only really since I've delved into social media and groups like MS Society and MS Together and stuff that you realise that you aren't on your own. So yeah, that was kind of me really in that situation.
Thank you, Sean. Yeah, definitely. I think again that's a big theme for this whole webinar, that you're not alone, and hopefully by seeing all of you sharing your stories, people won't feel alone if they are newly diagnosed. So yeah, thank you very much for that. Razia, so obviously these are all very different but also quite similar experiences of the diagnosis. What should happen? Again, obviously this will be different for everyone, but generally what's kind of I guess the timeline of things that should happen after someone is diagnosed? What should people expect? And I guess also if you could touch on maybe treatment options and lifestyle management, that might be quite helpful as well.
Yeah, it's okay. So you should expect to see, so once you have been given the diagnosis, you should expect to see somebody who, because it depends where you are at that stage. If you've seen a neurologist and then they need to refer you, they're suspecting MS, then they refer you on to a MS neurologist. So the expectation is, according to the NICE guidelines, that you will get seen by 6 weeks. If you've been provisionally told that it possibly could be MS. And then after that diagnosis is given, you will be referred on to one of the MS nurses within the team, where you've been seen. And then again, treatment options would also be offered when you talk to the MS nurse, or neurologist maybe already in the first initial consultation may, as part of your diagnosis, give you the treatment options as well, where they feel are the best treatment options. And then you meet further with your MS nurse, and then she will give you further information on all the treatment options, and then you can make an informed decision by reading all the information, benefits, side effects, and everything. And then with regards to treatment options, so there is a variety of treatment options for the relapsing-remitting MS. There's things like injections, tablet form, infusions. They all vary from in terms of efficacy. So sometimes your neurologist may give you like maybe 3 or 4 options and say these may be better suited for you. So then you talk to your MS nurse, or you can also call us on the helpline if you want further information on any of those treatments as well. So myself, Jennifer, and Liz, we are available on the helpline that you can get further information. And also, so moving forward as well, so anybody with MS should be, so according to the NICE guidelines, should expect to see somebody specializing in MS, whether it's MS consultant or MS nurse, somebody who specializes in MS at least once every 12 months. So once a year, you should have a comprehensive review by somebody specializing in MS.
Yeah. Thank you. And what should people do if they're not getting that? Should they kind of complain to their hospital? What's kind of the process? Because I know a lot of people don't even get that. So
yeah, I know. So they could contact. They should have because anybody with MS should have their first point of contact would be their MS nurses. So, for example, if they're having a relapse, they're having a new symptom, so MS nurses would be the first point of contact. And if they are concerned that they've not had their yearly review, then they can also contact the MS nurse, and she'll be able to pass the message on to the consultant. On the other hand, if you are not able to contact the MS nurses, then you can also contact the consultant through their secretaries at the hospital. If you ring the main switchboard number and ask to speak to the consultant secretary and leave a message if you are concerned about your symptoms. And also because if you are taking a disease-modifying treatment as well, it's important to have that catch-up to see if that disease-modifying treatment is working. Because if you're still having relapses, then it may be that you need to have that discussion with your neurologist to think about escalating your treatment.
Brilliant. And just very quickly before we move on, what about lifestyle changes or lifestyle factors that could help people post-diagnosis as well?
Yeah, so we don't have any conclusive evidence that lifestyle changes on their own can improve MS or slow down the progression. But some studies have shown that stopping smoking and doing more exercise can actually help improve fatigue, pain, balance, and mobility problems. So some of the symptoms it can help with. But again, it's advisable to have maybe a combination. So you have your disease modifying treatment that will help with your reduce relapses and slow down progression, but then the lifestyle can help with some of the symptoms.
Thank you, Razia. So next question is, obviously all of you have had quite difficult diagnoses. And I guess what would be really nice to hear is if there is anything that might have helped you when you were diagnosed that you didn't have at the time, or anything that did help you. If it was your support system but yeah, just what would have helped you? What would have made it easier for you? Sean, I'll come to you first, if that's all right.
I think at the time of diagnosis, for me, if I'd have had somebody there at the hospital it would have helped. I was being stubborn. Dad offered to come with me. My partner offered to come with me. And I said, no, it's fine. They're saying they don't think it's MS and blah, blah, blah. I'll be fine. Don't worry about it. I've been through worse. And I was there on my own and having to drive home afterwards, having to, calm yourself down and settle before you got in the car was difficult. But I think realising that you're not on your own and the support is out there, which I think is why, tonight, like you said, Amy, is so important. There is so much support out there. It's just finding it, realising that it's there. I'm under the Queen Elizabeth Hospital in Birmingham, and they've been amazing, absolutely amazing, and so helpful and supportive. Others out there don't always have that experience with other hospitals, but they really opened my eyes to the opportunities that were out there to get support from all the various charities and social media groups and all that sort of stuff. So I think that's the main thing there, really.
That's brilliant, thank you. And Alicia, I'll come to you next.
I wish I just kind of at the time of being diagnosed had immediate support. Friends and family, I live quite far from my immediate family, but I did have a lot of good friendship support network. But in terms of professional support, there was a lack of. I felt like I was begging for support and help in the hospitals. I was being told, you don't look unwell. I had a 5-day stay in a hospital to be told, oh, well, we just don't know what's wrong with you. You can walk. You just need to go home. It was quite traumatizing on reflection. Do you know what I mean? And this is why I had to then advocate heavily for myself and put in complaints and take it further because it was just, I shouldn't be treated like this. I need some sort of support. I cannot feel my legs. I can't feel parts of my body. Something is up. They said I had MS 2 months ago, and do you know what I mean? But it took 2020 to come, and I had a very bad relapse in 2020 where it looked like I'd lost vision, both eyes, and it looked like I had a stroke. And I decided I wasn't going to hide away, and I found major support on social media. And that's when I was like, there is a whole community. Oh, there's people here. Do you know what I mean? So it's taken for me to come to social media to find everyone. Do you know what I mean? And for people to find me and for me just to be open and out. So, but I just wish that was there from the beginning instead of like nothing. I didn't get leaflets. Do you know what I mean? Yeah.
Yeah, it's shocking. And obviously, I think it's amazing that you were able to advocate for yourself, but is there any advice that you could give to someone that might be feeling like they need to advocate for themselves, but they're just not feeling that they can?
Contact the MS helpline. Contact the MS helpline because they will be able to signpost you to wherever you need. Speak to a member of your family, speak to a friend, anybody that is there as good and trusting support. Do you know what I mean? Can't just make that connection with people. Contact the MS helpline. Definitely.
Brilliant, thank you. And Leanna?
So kind of same as Sean and Alicia. When I was first diagnosed in 2013, it was like 11 years ago now, and I felt very alone. Social media has evolved so much in 11 years, like even in the time. And I kind of didn't get a chance to touch base, but I was diagnosed in 2013, but I was lucky enough to not have much problems. And I talk about me being re-diagnosed unofficially in 2020 because I relapsed pretty badly in 2020. So from 2013 when I was first diagnosed, there was nothing out there. There was nothing on social media. Social media just it wasn't where it is today. So I kind of just didn't do anything from 2013. I wasn't seen by doctors or anything like that. So in 2020, I found MS Together, which I'm a massive advocate for because it changed my life. It gave me the from 2013, I didn't feel confident to say I had MS. If I did have any hiccups or any kind of flare-ups, I would just joke around and say, "Oh, too much dancing," or just made a joke of it, and I just didn't have the confidence to speak and say that I actually have MS, because on the outside I look okay, but obviously internally my body's fighting against me. So for me, it's having the social media platform that we do now, that you can speak to people, you can have the support of your family and friends, that they can be an amazing support, your work colleagues, but actually being able to speak to people who are going through the same thing to an extent, day in, day out, and being able to ask those questions, that no question's a stupid question, is what I would have liked to have had, because then back in 2013 I wouldn't have felt so lonely. I think that's a massive one for me, for sure. So social media and the likes of MS Together, who are advocates for young people with MS, is amazing.
Thank you, Leanna. And yeah, I mean, it's exactly what I needed when I was diagnosed, which is obviously what led to the start of MS Together. But it is just about having people that really understand it. It really is so important. So yeah, thank you for sharing that. And Razia, I'll come to you now. So a bit of a different question, but for someone that might be feeling, quite scared for the future. Obviously, there's been loads of, advancements in MS treatments over the past few years, and the kind of MS landscape is changing, if you like. Can you share any kind of information around like new developments or research, and maybe just a bit of hope for people about kind of the future of MS?
Yeah, so there's lots of new treatments, like I mentioned earlier. So in the past we didn't have any treatment options for the primary progressive and secondary progressive. So now we have treatments for those two types as well. Whereas in the past we had treatments that were maybe 30% effective, but now we have treatments that go up to 70, 80% effective, and they are available as first line option for anybody newly diagnosed with a relapsing remitting MS. And at the moment, there's a study going on, Deliver MS, which should be finishing soon, because at the moment we don't know whether, when you're first diagnosed, whether it's good to start on a lower efficacy medication and then escalate as if that doesn't work, or is it better to start on a higher efficacy medication. And this study started a few years ago to look exactly at that, because there's been some smaller studies in the past, but we've not had a bigger study. So this Deliver MS is a bigger study to look at what will be the best option, because there'll be three arms in this study. One group will be given low efficacy medications, second group will be given higher efficacy medications, and there'll be another observational group which will be given a choice of their medication, and they'll be monitored very closely over the next few years. So their study should be coming to an end, and then we'll know a little bit more what would be the best, because at the moment we just don't have enough information. There's been other studies are happening as well. There's Octopus trial, which is taking place in Cambridge, and that's looking at metformin and clemastine in combination, if that can repair the myelin in relapsing remitting MS. Other studies are looking at things like slowing down progression. Chariot MS is another study which is taking place, and that is looking at whether cladribine is a medication, MS medication, which can slow down worsening of hand and arm function for people with progressive MS. Because up till now, a lot of studies, they are mainly about, people who can walk, but they don't look at the upper function, because, that's important as well. And there's one more study, which is the simvastatin. So it's called MS STAT2. So there was what STAT1 took place already, and now is the second version of the same study, and that's looking at improving level of disability and slow down the disease progression as well. It started in 2021. It was a 3-year study, so it is due to finish, I believe, this year. So we'll get results. We don't have the results yet, but they will be uploaded on our website once they come through. But I think main thing is for anybody who's going through that diagnosis process and do get diagnosed, main thing is, staying positive, carry on living your life as normal. There might be that you might need to make little adaptations, little adjustments. So in the past, maybe if you were doing a 3 mile walk in one go, it doesn't mean, getting diagnosed with MS doesn't mean that you can't do that anymore. But it may mean that you may do 1 mile, have a little break, do another mile, have a little break, and do another mile. But it doesn't stop you from doing things. Same with, work-wise as well. So MS is classed as a disability, and work-wise, you let your manager know, and they have to put things in place which are called reasonable adjustments to try and so you can stay in your job and provide you with additional support if you need any.
That's brilliant. Thank you, Razia. You covered loads there. And yeah, some really good points. I mean, it's really exciting, I think, a lot of the research that's been done. But yeah, I think your kind of advice to everyone was really lovely. And definitely with the work stuff, if people are still working, definitely, if you do feel comfortable speaking to your employer about it, reasonable adjustments can be life-changing. So I definitely recommend looking into those as well. Last question, I think. So, the big question, I guess, is what advice would you give to someone newly diagnosed? And it can just be a little thing, but Alicia, I'll come to you first.
Um, I I wrote a post. I like to blog, and I wrote something for the MS Society. I think it was last year in regard to grieving and going through the 5 stages of grief. We associate grief with death, but also I didn't realize I was grieving the old me. It took me 2 years for me to fully come to terms with, I've got MS. This is what's now happening to me. You can't do what you used to do, but you can still do it, but just in a different kind of way. It took me 2 years, and I didn't realize I was going through a lot of anger. My advice to everybody is work your way through the stages, because and get support and get help while you're doing it. But you have to go through a process in order to come out of the other side for you to feel great about yourself again. Your life is not over. It just means little tweaks here and there. But I just call it the 5 stages of grief. But do you know what I mean? At the end, there is light at the end of the tunnel. There is. And anyone who's not prepared to kind of adapt with me, you've got to go, because I don't need stress in my life. I just don't need it at all. So you need to, we can part ways, and I'm fine with that. But I have this disability, and I am very mindful about my stress level. So anybody who's causing you stress or anything like that, no, let's not do that. Do you know what I mean? No relapses here. Let's, do you know what I mean? So yeah, go through the stages, go through the process. Do you know what I mean? And don't be too hard on yourself.
Love that. Yeah, completely agree. Thank you. Leanna, I'll come to you.
Yeah, so again, I would reiterate, don't be hard on yourself, and don't let anyone tell you how you should be feeling when you're first diagnosed. You can feel however you want to feel. Everyone feels different. Everyone deals with things differently. Give yourself time for sure. Don't start Googling everything, because Google can be there's so many different things on Google, and there's a lot of conflict in information, right, as well. You need to speak to the people, the important people, your doctors, your MS nurses, your support groups. Those kind of support systems are really important, because that's when you get the information that you really need. And like I say, any question that you have, in the support groups and with the MS nurses, they're always on hand to be able to help, and they're the right place you should be, not on Google. That's what I would say.
Thank you, Leanna. Really good advice. And Sean.
I think it's taking time for yourself. It is, whether initially you like it or not, it is life changing. And it's a huge adjustment in a lot of cases to make. It's a lot to come to terms with. I think I kind of understand a bit more now listening to what Alicia said about the 5 stages of grief. I'm almost 2 years post-diagnosis, and I still don't think I've come to terms with it. Learned to live with it a bit more, probably. But I don't think I've come to terms with it. And don't be afraid to reach out to people. Like the NSC, don't go googling all the symptoms, because you'll hear all sorts of horror stories, and you see questions in the chat about what happens with lumbar punctures. I asked questions when I had a lumbar puncture, albeit it was for different reasons, but it just doubly confirmed the MS diagnosis. And you hear all sorts of horror stories. You tend to find that people say more about the negative things than the positive side of things. But just be eyes open and do it at your own pace as well, because your mental health is very, very important, very, very important. And talk to people. Don't bottle anything up. Talk to people. Ask questions. You aren't alone. There's loads of us out there. So yeah.
Amazing. That's really lovely to finish on. Yeah, thank you all so much. That was really, really helpful, insightful, and yeah, just very, very eye-opening, I think, for a lot of people. So yeah, thank you all so much. I'm going to pass on to Leanne now for the Q&A session. But yeah, thank you.
Fab. And it was really lovely to hear from you, but it's even nicer to see the comments and somebody just saying that this has made me feel a whole lot different in regards to my diagnosis, which I think is really nice and really empowering, actually hearing for your guys. So thank you so much for sharing. I'm going to ask this first question because it came in quite early, and Razia might be the best person to kickstart us with it. But what are the signs of a relapse?
Yeah, so a relapse is a new symptom or reoccurrence of an old symptom, which stops you from doing your activities of daily living. So that's the best way to describe it. So, for example, you wake up and your legs might feel weak, or your arm, and and it has to last more than 24 hours as well, and be constant in nature. So any new symptom or reoccurrence of old symptom last more than 24 hours. And also what you need to be aware of, it has to be in absence of infection or increased stress. So if you have an infection anywhere in your body, chest infection, urine infection, any type of infection, cough and colds, you may feel that having symptoms similar to a relapse, but this is a relapse we call pseudo relapse because it's triggered by the infections, and it's similar with the increased stress as well. So our bodies can cope with so much stress on a day-to-day basis, but when that gets too much, then your body may experience new symptoms which you may never had before. But it is a case of, I think, if you know that they are stress related, then it's a case of letting the stress settle, and then your symptoms will start improving. Similar with the infection as well. If you feel it could be, if it's a bladder infection, you may want to take a sample to your GP. They can check your urine in the surgery, and they can tell you whether it's an infection. If it's an infection, you'll get treated with the antibiotics, and then your MS symptoms will start improving and they'll get better. But if it's not infection related, and it's a relapse, stopping you from doing your activities of daily living. So like I said, it can be weakness in any of your limbs, or it can affect your eyesight, optic neuritis. So anything like that, contact your MS nurse. Just need to make sure the symptoms have been present for 24 hours at least.
Excellent. Thank you, Razia. Anybody want to add anything to that in regards to relapses? I like the idea of keeping the stress levels low. Alicia, I can very much resonate with what you were saying there about cutting down the stresses. That's a big one. Thank you very much, Razia. Quite a few, so quite a few questions have come in regarding work in MS and telling your employer. So does your diagnosis affect your job at all? And do you tell your employer about your MS? And is there any adjustments you've had made?
I think
So,
from
oh, sorry,
go,
go, Sean.
go first. Okay, I think from my point of view, my employer, I'm very lucky in that my employer's been very supportive. I I joined the business that I'm with now just after quite a nasty fall where I badly broke my leg, which coincidentally, my neurologist thinks that I was potentially relapsing at the time, and that could have been what caused the fall that I had. Going back to answering the question, my gaffer and the team that I work in have been fantastic, particularly in terms of the amount of hospital appointments, scans, MS nursing, problems with um, bladder infections and the like. And it doesn't affect, for me, it doesn't affect my job. And MS doesn't define me. It doesn't stop me from living my life. Yes, as we said earlier, things have to be done slightly differently, but work have just been great about it. And I think don't be afraid to tell your employer. Um, be honest with them. Be open. And if they're not going to adjust to you, and they're not going to help you and support you, like Alicia said about, if you're going to cause me stress, then do one. You really need to think about, maybe changing jobs and changing employers to one that is going to be supportive of your needs and adjust and help you and work around you. So that's my sort of thoughts and feelings on it, really.
Yeah, I kind of second that, Sean, as well. When I was diagnosed, I was actually going through work interviews, and I was sitting there. I was like, do I tell them? Do I not tell them? I ended up not telling people. Um, would I do it differently now? Yes, I would, because I'm actually quite proud, I would say, that of my MS now and how I handle my MS, and I don't let it affect my work. But in regards to employers and what Sean said, we're MS is a disability. We were protected by the Disability Act. If they don't support you, then you're not in the right place. An employer should support you 150%. I am quite lucky. I've been very open with my employer. I've been my employer for 10 years. They've kind of known me from round about the start of diagnosis all the way through to now. I get to go away I go into hospital every 6 weeks for Tysabri, which is a disease modifying treatment for some people that might know that. They let me go off. I don't have to take off as leave. I just go off. I have the full day off. I get to rest, relax, and go back again. You don't have an employer that doesn't support you that way, then you're definitely not in the right place. So it's just having the confidence to be able to tell your employer, right, that's the hardest part. And that comes with the growth of accepting your MS and so on. So, but yeah, just be as open as you can as possible, and if they're the right people for you, they should support you.
I agree. It's the same for me. My employer has been fantastic. OH assessments in place. Risk assessment at my desk has been done. Risk assessment at home's been done. So I'm working from home. It's just they are very supportive. I cannot complain.
Yeah. Thank you very much, guys. And this one, Razzie, I'm going to direct to you. So somebody is just really newly diagnosed past couple of weeks, and their first appointment with their MS team is July. They're asking, is that a normal waiting time and what to expect?
Yeah, so due to I know we're coming out of the pandemic, but I know there's been some delays to the 6 week waiting time. So he said we were diagnosed 2 weeks ago, yeah, July. So it's about 7, 8 weeks away, maybe the appointment. Yeah,
Yeah.
and the expectation would be
Have I froze or is Razia froze?
Razia.
Oh, I was like, is it me? Is it Razia? I think we've just lost her. Which we'll continue on. Somebody had just mentioned this the symptom of fatigue and how do you manage it? So I'm going to open it up to you guys.
I sleep every day. I had a nap just before this meeting. I sleep everywhere and anywhere. I will sleep at my desk at work. I will sleep in a vehicle on the way anywhere. And everybody who knows me now knows, give her nap time, she'll be back round. She's fine. Leave her. She'll come back round and she'll be great. If my body needs to sleep, I'm sleeping. I just don't do, if I'm going to drive or something, I won't do long distance driving. If I need to go and do shopping, that's fair enough. But I sleep and I sleep, and I'm not going to deny my body of that. I'm not going to do it because I just feel like everything else kind of sets in. So as long as I'm rested, I'm good to go.
Fatigue's something I really struggle with. And when I was off and I broke my leg, I said to my partner, I'm gonna have to go to the doctors once I've got all this stuff out of my way with my leg, because I can't carry on like this. And I'm on a lot of medication at the minute, but this is, enough's enough. As it turns out, the MS was there, and I still struggle with it now. I'm on medication to help try and combat my fatigue. It's not to say that it's right for everybody, and this isn't advice, but that's what seems to be sort of helping me. I take medication before 8 o'clock in the morning, and it kind of helps wake me up, and helps get me through the day. My job can be quite challenging. I go through fits and stages where I need to do a lot of driving for work. So that's helped me a lot, and taking things at my own pace as well. If you go out for the day, like Razia was saying earlier, if I need to sit down for 5 minutes and catch my breath, then so be it. I'm going to Legoland for the day on Saturday, and it'll be keeping it at a pace, not rushing around like a headless chicken, for want of a better term. If I need to sit down for a bit, I need to sit down, and that's it really.
Thank you very much, Sean. And that is so important. Pacing yourself, I think, is so hard, so difficult, and trying to keep up with everybody. But yeah, pacing, having that nap, listening to your body, so, so important. And Razia, you have rejoined us. You had just
Sorry.
frozen, but the person being seen in July, that is a sort of norm, what we'd kind of class as a normal waiting time
Yeah,
right now.
I would say, yeah.
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 And I was going to say, if somebody has been diagnosed, but their appointment is like beyond July, could they phone up their MS team? Could they, check in with their MS nurse if they
Yeah,
had any concerns?
yeah, they can try because there might be some like maybe cancellations or some way they can maybe get in sooner. Or if they want to maybe have a telephone consultation that might be arranged early. A lot of appointments are still telephone consultations as well with the MS nurses, so they can maybe give them a call and find out more information. Um, and see what would be the best way forward. Even if they can give them some information on treatment options they may be discussing in that appointment, if they can give that information beforehand, then at least they can do the research before the appointment as well. That can be helpful.
Yep. Excellent. And talking about that appointments then, how do you guys prepare for your appointments? So, Alicia, how would you prepare for an appointment?
So writing down questions, any questions that I have, if I'm going to meet with my neurologist once a year, I have meetings with her. So, and I do that every single year since being diagnosed now. And I'm on an infusion at the moment of Tysabri, so go hospital monthly. So I used to get really bad, like it felt like a hangover after the infusion. So now I know, like I just kind of drink loads of water prior to that, clear my schedule because I already know when I come home, I'm going to sleep. I just kind of like just have that time and just prepare myself. So I just don't try and do too much. Do you know what I mean? Just don't. So I'll prepare for my appointments with my neurologist, MS nurses, with questions if I've got them. And for my infusion, I just drink loads of water and just make sure that I am fully hydrated.
Excellent. Thank you. Sean, what about you? How do you prepare?
Um, Writing down questions. I've started last couple of appointments I've had with the MS nurse and with my consultant, and my partner comes with me. Just in terms of anything that I've forgotten or whatever. In terms of my infusions, it's slightly different for me because I'm on Ocrevus, which I have every 6 months. Very much like Alicia, there's effects afterwards. I need to take things at my own pace. And work don't put any pressure on me to work. There was one infusion where I chose to because we were really busy, and if anything, it kept me occupied and it gave me something to do other than watching Netflix or sleeping, which I've done other infusions. But there's no pressure to do anything like that. I've got a fantastic chap that works for me, and just making sure that if there's anything that needs to be covered, it can be covered and all that sort of stuff. And there's no pressure, and making sure I'm not putting pressure on myself more than anything for stuff like that.
Thank you very much, Sean. And Leanna, is there anything you want to add?
No, not really. I used to be quite naive when going to appointments. I never used to prep. I didn't go with anything. But after speaking with people, I now know the right questions to ask. And also, a lot of doctors, neurologists, they're not really keen to show you scans sometimes. I've heard that. So if you want to see your scan, ask to see your scan. That's what I would do. So I asked to see my scan now. I like to be able to see from a year, like last year to this year. I like to see that difference, and there might not be anything, but it's just a peace of mind, right? So for me, it's just asking the questions that you feel that you sorry, mine's gone blank there. I've had mine blank. Just asking those questions that you might feel you think the doctor should be telling you stuff. Again, I used to be quite naive. I used to think that the doctors will just tell me and that's it, I'll just go away. Whereas now I'm more inquisitive to ask more questions now. So yeah, definitely prepare with your questions before going.
Yep. Thank you very much, guys. Really useful tips. Um, and I'm just conscious of the time there as well. So I'm just getting a mind blank as well. It's getting to that point in the evening where I was like, I was just going to tell you all my name, but I'm going to rein it back in and say that thank you for everybody that did submit questions, and I had a lot of it had been answered as you guys were chatting anyway, so we did cover that as well. But just to remind you, I'm getting with the MS Society with the Living Well team. We do run these monthly webinars on like a variety of topics, and fatigue is our next topic as well. So just knowing that that support is there is really helpful. Of course, we've got the MS Society helpline and the MS nurses on it with Razia. So really great to know about that, and just checking out the website for a bit more information. And of course, there is Amy and MS Together. I'm going to let you finish off, Amy.
Thank you. Yeah, so obviously the MS Society have got some amazing support for newly diagnosed people. And then for MS Together, we do things more kind of social support, and mental health support is kind of what we focus on. So we've got things like online support groups. We do virtual and in-person meetups as well, which are kind of just social and fun. We have just literally announced an MS Together tour where we're going to be traveling around the country, hosting meetups for people that are accessible and cheap, for people to attend as well. We also have a mental health, my mind's going blank now, a mental health first aider service where people can reach out to someone that's trained in mental health first aid, just if they want some signposting or just someone to listen to any concerns that they have. And next week, we're also launching a pilot counselling service as well. So I'm really excited about that. And yeah, so you can find all of that on the website. Leanne will provide links to everything as well. But yeah, the main thing really is that there's loads of support out there. Obviously, MS Society, MS Together. There's other amazing charities as well that provide support for people with MS. So yeah, it's just about finding what works for you, what you need at this time. And just, yeah, you're not alone. I think that's the main thing to take from tonight. So yeah, Leanne, if you want to close.
Yep. Thank you so much, guys. Thank you to the panel, to Amy for this webinar, and thank you for joining us, guys. And I'll follow up with that email just shortly. Thank you.
Thank you
See you
so
later.
Thank
much.
you all. Take
Thank
care
Bye.
then.
you. Bye.
Bye.